Good afternoon. Thank you all for joining us today. My name is Deborah Farrington, and I am the Deputy Secretary and Chief Health Equity Officer for the North Carolina Department of Health and Human Services. We're grateful to be able to have this conversation with you all today and want to say to those who have been personally impacted by Hurricane Helene, as well as your loved ones, I want to first say our thoughts and prayers are with you and all those whose lives have been touched by this storm. I also want to say a thank you for everything that you have and continue to do to help with the storm recovery. Our lives are forever changed, but we are all in this together. So many nonprofit organizations, community groups, churches, small businesses, volunteers, and local and state federal agencies have joined relief efforts and worked hard to support all those in Western North Carolina who were impacted by Hurricane Helene. Our goal in bringing everyone together is to enhance our ability to coordinate together to best serve those who are recovering from the hurricane. Thank you all for showing up to take care of one another during this difficult time. While a lot of progress has been made on the ground, and we recognize there's a lot more work to be done in the weeks, months, and years to come. We recognize experiences have been diverse across communities throughout the region, and people who have been impacted are in different stages of grief and recovery. During the next 90 minutes, we will share updates about services and resources being provided by state, federal, and nonprofit resources. We will cover in DSNAP, public health, housing, food services, mental health services, and other ongoing supports. There will be an opportunity for you to ask questions and share your comments throughout the session. We want to hear from you on how disaster response has and recovery has gone well. We want to hear how it can be improved and unmet needs that remain. While we recognize that we may not have all of the answers just yet, we will work to provide information as quickly as possible. Our goal is to provide resources and information, listen to your experiences, and learn how we can assist efforts in ways that work best for you on the ground. We want to understand from you the best ways to support you. To help guide this discussion today, I'd like to introduce my colleagues, Carolina Salicio Perez and LaDonna Huffaker. In addition to working with our partners to provide resources and support to the region, Carolina and LaDonna have both have experiences and roots in Western North Carolina. They, as well as all of us at NCDHHS, are dedicated to walking alongside you, our fellow North Carolinians, for the duration of this recovery efforts. And so with that, I'll turn it over to Carolina.
Thank you so much, Deborah, for that introduction. As you mentioned, I'm Carolina Salicio Perez, and I'm the Acting Director for Latinx and Hispanic Policy and Strategy at NCDHHS. I am very humbled to be with everyone today. And as Deborah just mentioned, this afternoon we'll share updates on recovery efforts throughout Western North Carolina. We have with us today representatives from public health, environmental epidemiology, multi-agency shelter transitional team, Healthy Opportunities, the American Red Cross, FEMA, and Back at Home. We'll also have members addressing mental health, members from Impact Health, United Way, and the Salvation Army to share updates and answer any questions you may have. On that note, please submit questions or comments using the telephone number on the screen, posting them in the Q&A, or if you are joining us by phone, just press 0 at any time on your keypad. My colleague, LaDonna Huffaker, is standing by to help direct your questions and comments. We will answer as many questions as possible in the time we have. I want to note that we will take questions after each speaker on the topic they'll be discussing. So to begin, we would like to share an update on the Disaster Supplemental Nutrition Assistance Program, or DSNAP. Here with us is Madhu Volimiri, Deputy Director of the Division of Child and Family Wellbeing, and the team working to support DSNAP. Madhu, we know that the application deadline for DSNAP was last week. Can you provide some updates on the program?
Sure. Thank you so much, Carolina, and thank you for having me on this call. So DSNAP is a temporary disaster food assistance program that provides 1 month of food benefits to people who have been impacted by a natural disaster. Carolina is correct that the application period for phase 1 of DSNAP has now closed. As of October 29th, so yesterday, 67,479 households and 170,795 people were approved for DSNAP benefits. And these benefits add up to over $41 million in financial support going to Western North Carolinians. DSNAP benefits are issued on an EBT card and can be used for 9 months. So with the application period for phase 1 now being closed, I just wanted to recap that phase 1 of DSNAP happened in 25 Western North Carolina counties that were impacted by Hurricane Helene, and it ran from October 18th to October 24th. The United States Department of Agriculture approved North Carolina for a 1-day extension of DSNAP in 5 counties on Friday, October 25th. We know that it was difficult for people to reach the call center last week with the tight deadline. And we do want to reassure folks who pre-registered for DSNAP in any of the 25 counties through epass.nc.gov. If they pre-registered before 4 o'clock on October 24th, but were unable to reach the call center to complete their DSNAP interview, those individuals will receive a call from county DSS officials to complete their application and help enroll them in DSNAP. So our ask is to please let folks know who have pre-registered for DSNAP, but were not able to complete the interview, know that they should anticipate a call between now and November 1st at the phone number that they provided in their pre-registration. The phone number who is calling them may be outside of their local area code. We are also eager to get phase 2 of DSNAP underway, and this will be for additional counties that were not part of phase 1. We are currently working to confirm the counties that will operate DSNAP as part of phase 2, the dates of operation, and to secure approval from the federal government through the United States Department of Agriculture. We will provide that update as soon as we have more information about phase 2 of DSNAP and where and when it will operate. We realize that more people would have liked more time to apply for DSNAP. Unfortunately, we are limited around how long DSNAP can operate due to federal rules. Typically, the United States Department of Agriculture only approves states to accept DSNAP applications for a 1-week period. We worked with USDA to get approval for the extension to Friday of last week, which was based on feedback from the counties that could take in-person applications for an extra day. We also worked with USDA to get approval from them to be able to call individuals who pre-registered but were not able to get through to the call center so that we can still help those individuals enroll in DSNAP before November 1st. What I would recommend that people do if they were not able to apply for DSNAP in phase 1, or if they were able to apply for DSNAP, but because it is only 1 month's worth of benefits, they find themselves still needing help buying food in November or even later, what I would recommend is that they apply for the regular Food and Nutrition Services program, which provides help buying groceries. People can learn more about FNS, Food and Nutrition Services, also known formerly as food stamps, at www.ncdhhs.gov/FNS. Again, that's www.ncdhhs.gov/FNS. The amount of FNS benefits that a household receives is based on several eligibility factors, such as the number of people in their household, their total income, and other deductions. Additionally, families with young children can apply for the WIC program. If they are a pregnant woman or have a child or children under the age of 5, they can get help buying healthy foods such as milk, cereal, bread, fruits, vegetables, eggs, and more, and access breastfeeding support and nutrition education. And they can learn more at www.ncdhhs.gov/NCWIC. Again, that's www.ncdhhs.gov/NCWIC. And then finally, we recommend people can call 211 or visit www.nc211.org to find nearby food resources. Again, that's www.nc211.org to find nearby food resources. Thank you, LaDonna. I will turn it back to you.
Thanks, Madhu. I really appreciate that. This comment and question comes from Diane Beth. You answered this already, but wanted to bring attention to this. Was a tight time schedule for DSNAP a state or USDA decision? Madhu, I believe you stated that this was a USDA policy.
Yes, thanks. Thanks for that question. Yes, it is typically federal rules that set the application timelines, and states typically do not get more than 1 week for the time period to accept DSNAP applications. So what we were able to do was request that 1-day extension, as well as the ability to call people who pre-registered.
Thanks, Madhu. And then we have a couple questions around what is the time, sorry, lost my thought. How many attempts will be made to contact people who pre-register? And if their call is missed, will they be able to have a direct contact for a person, or can they go to the local DSS to complete?
So that's a great question. So the county DSS officials will make 3 attempts to reach individuals who pre-registered but were not able to get through to the call center. And that's what we got approval in order to be able to continue to reach those folks who had already pre-registered but weren't able to get through. And so at this point, the best recommendation I can provide is to, if somebody is still waiting on that call, to be on the lookout for a phone call. And it may be from a area code that is not 828 or outside of your zip code.
Thanks, Madhu. And to follow up on that, there's another question for someone that has already applied and done the interview, and they've waited now five days waiting on response for that. Would you recommend that they go to their local DSS to ask the status of that update?
Yes, if you have completed the DSNAP interview but have not gotten an approval or a denial, a decision, and it has been 5 days, I would recommend following up. Typically, if the decision hasn't been made, it might be because they are waiting on some kind of information like proof of identity, just the primary information that has to be verified. So in that kind of unique situation, I would recommend going to the DSS and asking about the status, since you have already completed the interview.
And then this question comes from Ginger Parker Southard. What is the time frame that income is considered? Will they be able to apply even if they were previously employed and over the income requirements, but this storm has impacted that?
Yeah, it's a good question. And the time period that was reviewed for income was September 25th, so right around when the storm occurred, through October 24th. So when people applied for DSNAP, they were asked about their income and resources during that time period. And so we know many people may have lost jobs and thus their income changed dramatically. And so they may have been previously employed, but that's exactly why programs like DSNAP exist to address in a temporary manner the kind of immediate needs right after a disaster.
Thank you. And this is, I think, going beyond into the any kind of food assistant programs. If a family just arrived from Colombia and they do not have a social security number, can they apply for WIC if there is a 4-year-old in the family?
Citizenship is not a requirement for the WIC program the way it is for food and nutrition services. So I would recommend that family reach out to their local WIC agency and reach out and find out about eligibility for the WIC program, since a child under 4 would be eligible.
Thank you, Madhu. And then I have a question from Adam S. from Savage Freedoms, and then there's another question that can be paired with that. How does this actually affect those who didn't have access to roads or transportation for more than the initial week to file for these benefits? So I think this is just speaking to those that still had access issues in the response and recovery process from Helene.
Yeah, we definitely understand that there have been challenges with cell service, with many road closures, which is why we did try to have the pre-registration option for people to apply to begin the application online, and then the call center if they weren't able to make it in person. And so that was intentional in how we tried to set up DSNAP to recognize that this was really a unique situation where people were having major challenges because of the many road closures. And so we hope that folks were able to at least begin that pre-registration process or call the call center. And again, for ongoing needs, want to make sure people know that there is the FNS program and the WIC program for which people can call their local DSS to learn more about FNS, as well as other economic benefit programs like Medicaid and energy assistance and things like that, as well as WIC through their local WIC agency.
And then this, to follow up on that, for those that miss DSNAP and need to rely on traditional FNS, will they take into account the broader eligibility requirements available through DSNAP, such as citizenship requirements or justice-involved drug offense restrictions?
It's a really good question. So unfortunately, per federal rules, the FNS program does have stricter requirements around eligibility, such as citizenship requirements and requirements around those who are justice involved or have a previous drug felony. So DSNAP is different from FNS in that some of those requirements don't exist for DSNAP, like citizenship, but the FNS program does have that requirement.
And if somebody was denied the DSNAP, but it seems like that they should have been approved, is there any way to appeal or ask about the status of why they were denied?
Yeah, that's a great question. If somebody was denied but believes they should have been eligible, my recommendation would be for them to go to contact their county Department of Social Services where they reside and ask them to revisit their case.
Thank you. I know we have a lot more that keep on popping up in the chat and or the Q&A, and I want to make sure I can do a time check. Do we have time to take a couple more questions?
It also sounds, LaDonna, like we may have Wanda from Mitchell County waiting in the queue on the phone. So we may want to...
Why don't we go ahead and take the queue on the phone, and then I'll look through these to see if there's any.
Okay. We were without electricity for 21 days here in Mitchell County. We are having still some stress issues here with the citizens of Mitchell, Avery, and Yancey counties. On November the 13th and 14th, we will be at the Mountain View Correctional Center giving out donations to those 3 county citizenry. And I don't know how to get that information out, but I will be working there and I will be helping give out donations. Our churches are all working together, and which is a wonderful way for us all to come together in unity and work for our citizens of Mitchell County. I have become known as the driveway minister because so many people are asking me for prayers with them and for their families and situations, and also with the workers that have come from out of state, as far away as Hawaii, Alaska, and out of the country. Also for volunteers that are serving meals, handing out donations, donated items. And so I'm still praying with everyone that I can and working as hard as I can.
Thank you so much, Wanda. I am seeing in the chat, in case you don't have access to our chat, many thanks are being sent your way for all the work that you're doing for those 3 counties. And just someone shared in the chat, emergency headquarters can help you spread the word in your county. So if you have access to sharing this information with your emergency headquarters, let them know and they will share and help spread the word. Thank you so much for calling in and all the work that you're doing for all the individuals in your counties. And so I know for the interest of time, we want to move on and allow our next speaker to share important updates as it regards to health and safety, debris cleanup, and getting essential services back up and running. So I'd like to welcome Erin Fry-Sosny, who's the Director of Strategy for the North Carolina Division of Public Health. Erin joins us to provide very important information on ways to continue to support public health throughout disaster recovery and response. So Erin, please take the floor and share any updates or resources that you may have. And I can't hear you, Erin. I can hear you now. Oh, maybe not. No. Can we hear you, Erin?
We can't hear you, Erin.
Test. Can you hear me now?
Yes.
Yes.
Okay, excellent. So we at the Division of Public Health work incredibly closely with our local health departments, and I know a number of our local health department colleagues are on right now and just want to express gratitude for that partnership. One of our roles at the state is to provide folks with practical information about how they can protect their health. Many of these resources are online, and we'll share this important link in the chat at ncdhhs.gov/Helene. They include guidance on what to do when you're cleaning up from mold. We have some additional videos that will be going up today to help provide guidance for folks who prefer to learn that way. Some of our more popular documents involve toileting and what to do if your toilet isn't functional, how you can do that safely. We have information on well and septic systems, and we have new guidance coming on how to keep your hands clean if you don't have potable or clean running water in your home. So a number of these things coming. We also have information about generally keeping yourself healthy and safe while recovering from the storm. We encourage everyone to be getting their seasonal vaccinations for COVID and flu, and also to check with your provider if you are not, to see if you're up to date on your tetanus vaccination. That one is particularly important as you may be exposed out in the community. Another part that we are working on is getting services, as we work to get services restored, is partnering with local health departments on well disinfection and testing. So if you have not already and you have a well that has been damaged or flooded, please call your local health department and or come to one of our state sites for free disinfection kits and testing kits. We then take them back to a lab to test them for coliform bacteria, fecal matter, and E. coli, and we'll give you results back through your local health department to know if your water is safe to drink yet again. All of our information is online at the website I mentioned, and it is in English and Spanish. We also have print materials that are making their way and being distributed through local health departments as well as social media. So thank you. I will add quickly before we go to questions that related to our private well disinfection and testing. It's really critical that people don't drink water from their private well until it's been properly assessed. I will tell you that of the almost 1,000 test results we've received so far, about 40% of them have been positive for potentially harmful bacteria. And so we really do encourage you to make sure that you're getting test results before you drink the water. Thanks.
Thank you. Thank you, Erin. Ladonna, do you see any questions for Erin?
I just see a request to repeat the website.
Absolutely. That is ncdhhs.gov/Helene.
Thank you, Erin. And I went ahead and typed that in the answer, so that would be great. Okay, actually, some others popped up. Western North Carolina health providers have lost vaccine stock due to loss of power. Are there current efforts to make vaccines widely available here?
Yes, there are. I know that local health departments have been working closely with our state immunization branch to replenish stocks. We got an update today about more vaccines going out into the region. So please do contact your health department to find out what's available near you.
Thank you, Erin. Could you also talk about testing of the sand, silt, dust that remains after the flood?
Yeah, I believe my colleague, Dr. Guidry, will be addressing that a little bit in her remarks in just a moment.
Okay. And is this for submerged wells or any well?
Any well that is in the 25 counties that has been damaged or flooded. So this is not for kind of routine testing of your well. This is really for any well that has been flooded, meaning submerged or damaged.
And that question was from Jean Rowe from Pisgah Legal Services, somebody I know from my neck of the woods. So hello, Jean. Thank you for the question. So I think this is a broader question, and hopefully we can answer this here. This may actually go between you, Erin, and Madhu. Thank you for this tele-town hall. How are you supporting vulnerable communities, particularly pregnant and families with infants and young children? So I think that would be a great tag team response there.
Do you want to go first, Madhu?
Sure. I can start with an initial comment that our team at the Division of Child and Family Wellbeing, which houses the WIC program, has worked closely with emergency management on efforts to make sure formula is available in the Western North Carolina counties that were impacted most. So that is one of the key areas that we've been focused, in addition to also making sure that WIC is accessible for pregnant women and children under 5. And I can share a link with some of the flexibilities in the WIC program in the chat. That's really a critical resource for making sure families have access to formula. We do know now that the majority of grocery stores are back up and running and are accepting WIC cards, SNAP cards, EBT cards. And so getting folks connected who are not already participating in programs like WIC and food and nutrition services will be really critical as a next step for ensuring they have some of those longer term supports.
And I'll just
Erin?
add, thanks, Madhu, that I'm a parent, and times of crisis exacerbate underlying challenges that exist in communities, and we know this. And so in public health, we are providing resources, information for pregnant women, breastfeeding support, as was mentioned earlier, where to go, guidance on clean water. A lot of this is available on our website as well. But we know that what we're doing today is only one step toward what's really needed in the community. And so you'll be hearing more from us as we move forward about how we can really lean in and support communities that are particularly struggling and may have been already all along. And so we welcome your ideas and thoughts as we go forward. Thank you.
And to follow up on that question, is there any guidance or assistance available for childcare centers to open as soon as possible?
Yes, I can post in the chat the latest link that has come out, but we put out a week or so ago guidance for childcare centers to reopen from both a public health lens, but also a regulatory lens. And so we know that not everyone has access to potable water in their facility right now. And we also know that people need to get back to caring for children, and families need that critical resource. So there is guidance available and a pathway for folks to reopen. Thanks.
Sorry about that. What about lactation support? Are we working with the Western North Carolina Breastfeeding Coalition?
I don't have a specific answer to that, but I know that we have been in touch with the Western North Carolina Breastfeeding Association. I know there were comments that were made to us that we really appreciated to ensure, as we were working to get formula out, that we also made sure we were promoting messages around lactation support and that sort of a thing. So just really appreciate that question and that recommendation.
And that was from Love Anderson. And then we have another one from Sheila Arias. What about prenatal care, and is this all available bilingually too?
Many of those supports are offered by local health departments, and so it would likely vary by health department. But I don't know if anyone else has a more detailed response to that. But I really appreciate the question.
Thank you. This one is, I'm not sure how we would be able to answer this. This is from Javier Flores. If Department of Health for Buncombe County is not working properly due to Helene, can we attend other departments?
So the answer to that is yes. However, I do want to acknowledge, and I think we've got folks on from Buncombe County today, that they are up and running and have services operational. So just want to put that out there. Although we know folks that have been displaced for various reasons might choose to attend another health department just for proximity, et cetera. But Buncombe County is up and working well. Thank you.
And then Erin, I think this other question is, it says, what about springs? And I'm assuming that's like the guidance that's around well, ensuring safety.
Yeah.
Is that same for springs, or is there a different guidance for springs?
I need to double check on that to make sure that I'm correct, because I know we had some conversation as early as today about additional voluntary testing. So let me take a look and get back when we do our follow-up. Thanks.
And that question was from Jody Lovelace. Thank you, Jody. And we have a comment from Tara Schuler from Mountain Area Health Education Center, so MAHEC. Assures prenatal care for several health departments is back up and operating and providing prenatal care in the region. Thank you, Tara. I appreciate that. All right. This is another question from Sheila Arias. Is there a list of the health departments available for prenatal care that can be shared?
I know my colleague Tara Schuler is putting comments in the chat, so if you're able to add that list, that would be fantastic. Thank you.
We appreciate the assist, Tara. All right. Carolina, there is a question in the chat. In the Q&A by Griselda. Would you read it for us, please?
Of course. So, se está pensando en crear un protocolo que ya quede instalado en caso de una emergencia durante COVID y ahora bajo esta emergencia natural. Veo cómo tardan semanas en activar ciertas ayudas. So, is there any thought around a protocol that has already been established in case of an emergency during COVID, and now under this natural emergency, I see that it has taken weeks to activate certain help and support?
Yeah, I can start, and I want to thank you for that thought, and in particular, we know it feels like a very long time, and it is a long time sometimes. Living without some of these vital services. So we at the state have an emergency operations center program where we work as a statewide response, putting pieces together. And so some of those services are in place. These operational plans are in place. We can always do better, and we're learning all of the time. And I do want you to know that learnings we have put in place from prior things are coming to bear. This is a hopefully once in a lifetime situation that we're facing, and we're learning as we go, and we need you to continue sharing your ideas and thoughts about how we can do better. So really appreciate that.
Thank you. Thank you for that question, Griselda. And I also want to acknowledge we have Dr. Virginia Guidry on the line. We've heard from many that storage and disposal of debris has become a large concern for many due to environmental issues and the many other issues it can cause. Dr. Guidry, what is being done to monitor debris storage locations as people continue to recover from the storm? And what else do people need to consider?
Good afternoon, everyone. Thanks for that question. Again, I'm Virginia Guidry, and I'm head of the Occupational and Environmental Epidemiology Branch and also the Environmental Justice Lead for North Carolina Department of Health and Human Services. Regarding the debris collection sites, we have been hearing some concerns about the debris collection sites and where they are located. We have talked with our colleagues at the Department of Environmental Quality about these concerns, and our understanding is that one of the sites that was of greatest concern in Buncombe County near the Westmore Affordable Housing and Deerview Apartments is no longer accepting debris, so that site has closed. And we are actually working with partners to look at the locations of other debris collection sites. What I would say about protecting yourself, from debris, well, one is if you have any concerns, please raise them to us so that we can work with partners and try to, understand those concerns and provide some answers. Our understanding at those sites is that they are really focused on grinding and sorting and trying to, consolidate the waste as much as possible. There may be questions out there about burning at the sites. They are working to minimize any burning that is necessary, but that might be a step that is taken eventually. And I do know from talking with colleagues at the Buncombe County Health Department that they're working with the Army Corps of Engineers on and trying to understand their process so that they can, provide information to the community about that process and help answer some of those questions. I also want to circle back to the earlier question about protecting yourself from dust and soil particles. As everyone knows, we had the hurricane, and then after that, we have had a month plus of very dry weather, and we are hearing a lot of concerns about dust and respiratory concerns, and people are reporting respiratory symptoms. We do have some guidance on our website about how to protect yourself from dust and soil particles. And basically acknowledging that, yes, breathing in dust and particulate matter can affect anyone's health, but especially people with underlying health conditions like asthma or chronic obstructive pulmonary disease, and also older adults, children, pregnant people. And so we really want folks to pay attention to the dust. If you're having any symptoms like runny nose, watery eyes, sore throat, shortness of breath, please take those symptoms seriously. And in order to protect yourself, some steps that you can take include staying indoors if your indoor environment is safe, and keeping those windows and doors closed to keep the dust outside. You can also go to public buildings like a community center or a library. If you need to go somewhere that's cool enough and that has filtered air, please use those facilities if needed. And if you're need to be outside or especially doing cleanup work, please wear an N95 mask. It's important to talk to your healthcare provider before using a mask if you have any heart or lung problems, because it can make it a little bit harder to breathe when you have one of those masks on. But those N95 masks are available at hardware stores. Just look for N95 on the package. And just know that if you have a beard or facial hair, you have to sometimes remove the beard or facial hair so that the mask can fit properly on your face and really provide significant protection. So that's another option to use if needed. And I think I'll stop there and just see what other questions there might be.
Thank you so much, Doctor. As anxious as everyone is to clear out the debris from their homes and businesses, it's important to know and be aware of how to dispose of all of this safely and properly. I just want to remind those that you can submit your questions or comments using the telephone number on the screen, posing them in the Q&A, or if you're joining us by phone, you could press 0 on your phone keypad at any time. LaDonna, are you tracking any questions or feedback around this particular issue of health and safety?
Yes, I have. Let me see here. Sorry, my apologies. I have one person that asked if Buncombe County residents would benefit, or stated Buncombe County residents would benefit from multiple debris drop-off sites versus just having the option to place it at the roadway. Many folks live off the main road and don't necessarily have a spot by the road nor access to the right away. Thank you. So thank you for the person that put that comment in there, and we will take that information forward. I don't have any other questions about health and safety. I do want to state that it seems like some folks are trying to cut and paste links in the chat from the chat that are being posted, and have been informed that the chat's not allowing it. We will be sending out a resource follow-up with the links here from today's meeting. So thank you for that awareness. And then I think we have another question, Carolina, in the Q&A.
I see that this is more of a respiratory health question. Hi, if I already have the vaccine shot from last year and I'm in Western North Carolina, should I be taking any particular consideration on other vaccines given the hurricane? And Erin, I don't know if you want to speak to that.
Yeah, I'm happy to. So we do have an updated COVID-19 vaccine that we encourage folks to get, as well as a flu vaccine. Those are just regular good precautions that we recommend. We also recommend that folks talk to their provider to see if they're updated on the tetanus vaccine in particular, as you're out handling debris or other things, and the risk of being cut is there. So that's the other one we would recommend. And we have more information on that. We've put together a number of provider guidances for clinicians that are available online, as well as for the public, if you'd like to read more about that on our website. Thank you.
Thank you, Erin.
Erin, we have another question regarding guidance on childcare to reopen. The guidance that was posted for childcare to reopen is not clear. Some licensing consultants are not visiting centers at this time. They stated that environmental health will be visiting. The ECEs need specific guidelines and assistance with purchasing supplies like portable hand washing stations and porta potty rentals, including purchasing toddler seats to accommodate smaller children. I don't know
I
if there's
really
anything to
appreciate lifting that up. Our guidelines right now involve, and I can follow up if there's more, there is an additional checklist. So we have put out guidance for health, from environmental health that is in the form of a checklist and an attestation for folks who are operating childcare centers to go through. To my knowledge, we're not making visits to childcare centers at this time.
I see another question, Donna. It's related to vaccines. So, in terms of because of the hurricane, is it possible that all vaccines could be made free? That's to say that if I live within the 25 counties, would I be able to obtain free vaccination? And given the event, we may not be able to afford to pay for some of those vaccines at this time.
I don't know if there's others online that have more knowledge about free access to medicines at this time, but I do believe health departments have limited supply of free or reduced cost vaccines, and so I do recommend reaching out there. And just appreciate both the desire to protect yourself and really thank you for looking into doing that, as well as acknowledge the challenges around cost at this time.
I also see that Molly is sharing that Buncombe County is offering free flu, COVID, and Tdap vaccines. We also recommend reaching out to your FQHCs and your local and charitable clinics who may also be providing that as a resource near you.
And then this is a question for Dr. Guidry regarding debris. Ashe, Watauga, and Avery counties would benefit from debris drop-off sites and assistance with debris moving and sorting. I think that's just something to take back for awareness. Thank you for the person that put that in the Q&A. That is all of the questions I see regarding public health and safety around debris.
Thank you, LaDonna. Thank you all for engaging all your questions. If we're not able to get to your question, we're going to try to follow up where possible after the call, and we will be providing a list of these resources. Now, we'd also like to share information on relief efforts related to shelters and housing. While shelters are still readily available, we know that people are anxious to return to their homes. With us is also Carlotta Dixon with the Multi-Agency Shelter Transitional Team, also known as MAST, Maria Ramirez Perez with the Healthy Opportunities Pilot, Garrick Haberstock with the American Red Cross, Nicole Dyson with FEMA, and Emily Carmody with Back at Home. We can start with Carlotta to share those updates on efforts through MAST. Carlotta, are you available to share more about shelter plans as we move into the second month of recovery from Helene? Do we have Carlotta still available? If not, I see
Good afternoon.
Maria.
Good afternoon. This is Carlotta Dixon, North Carolina Department of Health and Human Services, Division of Social Services, CERT lead, that's State Emergency Response Team lead, HHS Recovery lead, MAST lead, Multi-Agency Shelter Transition Team lead. I wanted to share a PowerPoint.
I'm not sure we will be able to share a screen.
Okay, no worries.
Yeah, I think just a brief overview to kind of help us understand where we are in the process, what long-term and temporary housing may look like. Anything you can share, Carlotta.
Thank you for having me today. And so the Multi-Agency shelter transition teams are currently into the remaining shelters open. The remaining shelters open are 2 in Buncombe County, 1 in Yancey County, and 1 in Transylvania County. We are currently in the Buncombe County shelters. And what the multi-agency shelter transition teams do with a various federal, state, and county local partners, work collaboratively in case conferencing all of the individuals, engaging with all of the individuals and families within the shelters, identifying as having discussions with those individuals and families about their unmet needs, their temporary, short-term, and long-term housing plan needs, and working with those persons to identify next steps into carrying out addressing those unmet needs. Currently, the many housing plans that are available to individuals and families within the shelters extend from FEMA to local resources. And we encourage individuals and families and households within those shelters to engage with the BAS team to access those resources. The key members of those teams are FEMA, Red Cross, North Carolina Emergency Management, North Carolina Department of Health and Human Services, county departments of social services, veteran services, mental health, disability integration. Currently, we're going to continue working within the shelters, and then we will transition into the hotels where persons are lodging due to being impacted either by their apartments or by their homes. And we will continue doing outreach efforts in those hotels where those persons are lodging to ensure they are continuously being connected to services and programs. With that, I will yield to any pending questions.
I do see a question. It says, if migrant families without immigration status are at the shelter, will they still be supported with housing? We've heard that FEMA won't be supporting if someone doesn't have a social security number. And will individuals without legal status be able to be supported with hotel or housing assistance? And thank you for all your solutions and all of your insights on the housing topic.
So the answer to the question is, although any individual or household, regardless of their status, who are not identified to be eligible for some federal programs or state programs, state government programs, those families, we look to other housing solutions. There are programs that exist that will be upcoming in this town hall that will be shared with you. Back at home, and another program also that we can extend to persons that may not meet the eligibility criteria for FEMA assistance or Red Cross assistance or other state assistance. We also have a program that is a partnership between at the state level and the county level, social services identified as disaster recovery rental assistance program. And that is a program that is specifically identified for those individuals, households who may not be eligible for any programs, including the back at home program. So we try to ensure that everyone who is impacted by the disaster or may have been unhoused prior to the disaster and needs assistance, the MASS team tries to identify and work with those individuals and households in identifying housing solutions.
Thank you so much, Carlotta. And I do see that Nicole may want to add a little bit to that answer, and then we can maybe also allow Maria and some of our other housing experts to help elaborate with some of these questions.
Sure, thanks.
Yeah.
For letting me,
Sorry, I was going to say that, Nicole, I'm sorry. I was going to say that, yeah, I think that we would want to hear from our other partners before we answer some of these questions, because I think some of these questions can be answered based on what our partners are going to state. So I think after Nicole speaks, we could probably move to the next panelist. Thank you all for your questions.
I do want to mention that for federal assistance, for FEMA assistance, that a minor child who is a U.S. citizen or non-citizen national or qualified non-citizen may apply on behalf of their minor. They can apply with their minor child, with the child as the co-registrant, as long as they live in the same household. So that the parent is the co-applicant and the minor child who's under 18. And now, as long as they live together, they can apply for FEMA assistance that way.
Thank you, Nicole. Maria, I also want to allow you to talk more about the NCDHHS Healthy Opportunities Pilot and any insight that you want to share.
Thank you, Carolina. Hi, everyone. My name is Maria Ramirez Perez. I'm the Associate Director of Healthy Opportunities with North Carolina Medicaid. The Healthy Opportunities Pilots, or HOP, is a program that operates across 33 counties in North Carolina, and that includes 18 counties in Western North Carolina. So we provide, through this program and in partnership with the network lead in Western North Carolina, their name is Impact Health, we provide supports across 4 key domains. So it is food, housing, transportation, interpersonal safety, and there is a set of services that are also cross domains. So that means we also offer some services that are really meant to address needs that cut across those domains. Within the program, a person may be eligible if they meet clinical eligibility criteria and have a need associated with one of those 4 domains. So, for example, if they are food insecure, housing insecure or unstable, transportation insecure, or if they are in a situation where they are experiencing interpersonal safety concerns, or for children, they may be experiencing situations of toxic stress, which we can safely say is a situation that is unfortunately being experienced by many of the children in Western North Carolina at this time as a result of this disaster. So I just want to call out, we do not cover all of the 25 counties that were affected, but new enrollments for individuals that may be eligible for these services are now being accepted. HOP can provide supports in the housing space that are things like housing navigation, or utility support, home repair. But I want to stress it does not replace supports like FEMA, what FEMA is offering, what HUD may provide, or other state or federally funded programs. So you will hear from some of those over the course of this call. I really want to stress HOP is there to help address any remaining gaps. We know there's a lot of need. And so HOP is one of the pieces that will help kind of fit together with all of these different supports to be able to support the community in Western North Carolina. We are, again, a Medicaid program addressing non-medical supports, and it is a pilot. So these are services that are provided through your Medicaid managed care plan. They're managed or administered that way. So if a person wants to know if they may be eligible, they should reach out to their health plan by calling the member services line on the back of their Medicaid card, or by going to the NCDHHS website and typing in Healthy Opportunities Pilot, and that'll help you find information on your health plan. People, again, just the part I really want to stress is people should reach out to the Healthy Opportunities Pilots if they have a non-medical need, they're enrolled in Medicaid, and they are in one of the 18 counties. I will post them into the chat. They're in one of the 18 counties that are covered by this program. If people have an urgent non-medical need, they should continue to reach out to NC211, as that is a process that is designed to be able to address some of those more immediate supports much better, and may also kind of redirect things back into NC HOP for some of those supports that are more appropriate to be addressed through this program. Any questions? Or actually, back to you, Carolina, because I think we're doing questions.
Thank you. Yes, we've got a lot of subject matter experts on this housing topic. So we'd also like to welcome Garrick Haberstock with the American Red Cross to share any updates on what they're doing to support individuals transitioning from shelters into housing.
Yeah, thank you so much. Appreciate the opportunity to be here. As introduced, my name is Garrick Haberstock. I serve as our manager for shelter resident transition for the American Red Cross, and very, very blessed to be in the Western North Carolina getting the chance to serve. I think it's just really important to start with we're lucky as the Red Cross. Like, I thank you all for the opportunity to be here. We're one of the few nonprofits that you get to hear from today, with a mission of preventing and alleviating human suffering in the faces of emergencies. We do that through the generosity of volunteers and donors. And so I just want to take a step back and recognize where we started and where we're at now on the 30th of October. So when about a month ago, at our peak, there were over 1,100 individuals seeking sheltering across Western North Carolina, and a peak of more than 55 different locations of individuals seeking that refuge and safety. And where we've come today is, as of this morning, there were 7 remaining shelters open with 228 individuals, 25 dogs, and 9 cats, right? We just know how important pets are and household animals are in families' lives these days. And so with that shift, really what we're able to describe and really just reinforcing what you've heard from our 2 prior colleagues and who you'll continue to hear from is the work that we're doing to help families plan their exit from the shelter, right? As we and our shelter resident transition teams, think of them like caseworkers, begin to build relationships and spend time with families. We're really designed to understand their individualized resources, strengths, and barriers that they have to transitioning, right? I think this call has about 337 individuals on it. And if you just think about after the disaster, what would you need? That's how we desire to approach the relationship in shelters, to help families have a plan upon their exit. And I think the other thing is important to note, as we see shelters and shelter populations dwindling, that's because plans are being enacted and families are able to move on to a different solution that's not a congregate setting now that we're a month after the disaster. And with that dwindling of population may come some consolidation or eventually shelter closures. But again, the goal is that every household has a plan, a transition that they can move on to that really helps propel their long-term recovery, because we know we're just one month, 2 months small in that overall disaster recovery. Before I go back, I just want to frame up a couple of examples, just to give some tangibles as to the work our teams have been doing over the past month in building these relationships and helping build plans. And I'll just do 2 simple ones. So one is we think about this partner network in the community and lots of folks coming together to serve. There was a family that received a donated trailer from Habitat for Humanity. And the family's just waiting for that to be placed, to have utility hookups so that they can exit a congregate setting and into a trailer that they can stay in for the foreseeable future. That's one. Secondly, again, on these individualized needs, a family member lost their home and they have family in Knoxville, Tennessee. So our team has been working with them to say, how can we help get you to Knoxville? What do you need to get there safely? And is that family ready to receive you when you arrive in Knoxville? Those are just two examples, right? There's hundreds of others that we could do, but that individualized touch and that connection into the community is really what we're striving for as we see that shelter population decrease because folks are arriving at solutions. And then one final thing, huge shout out to MASS, the multi-agency shelter transition team, and HOP. You guys have been doing amazing work with our teams in the shelters, bringing about those creative solutions that households need from us. Yeah. So and with that, I'll pass it back because I think we're going forward to 4 more questions.
Thank you so much, Garrick. I think that you've done a great job at illustrating the complexities and the nuance, and then also the importance of the partnerships that are really helping navigate some of those unique needs and community members. Like we've seen with the questions before, right? It's not going to be a one size fits all, but it is these partnerships and these collaborations of thought partners coming together to find those unique solutions. I know that we had introduced Nicole previously. FEMA, Nicole is with Nicole Dyson is with FEMA, who is also on the ground to support many of those recovering from the storm. So Nicole, can you talk to us about the individual assistance program? I know you just fielded the mixed status household question, but please tell us more about this program. And I don't think I can hear you, Nicole. You might be muted.
Thank you for having me.
Thank
Can you hear me now?
Yes, we can hear you.
Okay, awesome. Thank you for having FEMA, and thank you for inviting us into the state as part of the recovery options for this disaster. I first want to say that FEMA assistance is available to individuals and households who may have been impacted by Hurricane Helene. The first step for accessing any of the benefits, though, is to apply for FEMA assistance. And there are 2 ways to apply. One is online at disasterassistance.gov. I just put that link also in the chat for everyone in case you don't have it. But you can also call 1-800-621-FEMA or 1-800-621-3362. Those are the quickest ways to apply for federal disaster assistance. And we have available under the individual and households programs, both housing assistance, federal direct assistance, and also financial assistance to individuals, as well as other needs assistance to address personal property losses, childcare, transportation losses, funeral losses, and other things that they may be eligible for. One of the things that I do want to kind of put out there is that FEMA assistance is not intended to make an individual whole. It is intended to get you started on the recovery process. And so even individuals who may be underinsured, if you're insured, but your insurance may not cover certain things, you may still be eligible for certain types of assistance under FEMA assistance. So there's a couple of key things I just want to leave with everyone is that to date, FEMA has provided more than $194 million to 119,000 households in North Carolina as they recover from Hurricane Helene. This is separate and apart from the Public Assistance Program, which provides assistance to communities for debris removal and also longer-term projects to help fix infrastructure. We're also assisting applicants by providing temporary sheltering assistance, which is when we pay directly to hotels for individuals who are eligible to stay in a hotel. We provided serious needs assistance to help with immediate needs such as medication, food, clothing, and we are still continuing to help individuals who may not who may qualify for direct housing, which is where they may be able to have form of temporary housing, either placed on their home or be at a commercial site. So those options are available to some homeowners. But again, the first step to determine what your eligibility for any of that level of assistance is to apply for FEMA assistance at 1-800-621-FEMA. And I will take questions if there are any.
Well, Donna, if we may, I do want to give Lisa a quick opportunity to share on mental health. I know we're about 15 minutes before wrapping up the call, and that the housing questions are popping. So I would just at least want to introduce Lisa, have her tell us a little bit about the mental health resources, and then we can hop back on to talk about housing, which will no doubt take us to the end of our 1:30 call. Is that okay?
Thank you, Caroline. I think that's great. Yes, because we'd like to also hear from back at home. It's Emily from back at home. So yes, let's go ahead and pivot to Lisa first, and then we can go back to Emily.
Thank you.
Thank you, everyone. Hi, my name is Lisa DeSantis. I am with the North Carolina Department of Health and Human Services Division of Mental Health, Developmental Disabilities, and Substance Use Services. I am our crisis services lead for the division, and we are overseeing the behavioral health crisis response for the Hurricane Helene relief. So I wanted to just talk about a couple of resources that we are putting into place. We have been awarded a FEMA/SAMHSA grant as of today for crisis counseling program, which will give us additional resources to put crisis counselors out, boots on the ground, responding in shelters as well as in the communities, in really working towards getting those supports in place to be able to link people to ongoing behavioral health and substance use supports in their community. This award, like I said, was granted, and we are going to be really working towards implementation over the next couple of weeks with that. We are also putting in, we have additional resources for our teens and young adults, especially, that we have put into place, and it is called Somethings. And this is a text and chat platform for our teens that would be able to reach out to a peer mentor to get some support as they are struggling through the recovery efforts as well. And we will put that link in the chat for everyone. We are also standing up our Hope for NC call line again, and that is support for individuals, first responders, volunteers, anyone who needs additional support in the community, and that we will definitely put that number in the chat as well. Also just want to reiterate that, you know, anyone can reach out for support at any point in time if they're struggling, and they can reach out through 988 Suicide and Crisis Lifeline, and that is for anyone at all who wants to reach out, and they can reach out through call, text, or chat for that support. They can then be linked to local behavioral health supports. If emergency is needed, they will make those arrangements, or if it is a referral that is needed, they will help with supporting that as well. We want everybody to make sure that they are taking care of themselves, that they are taking time to process everything that has been going on, and to get help for themselves and their loved ones if needed. I am happy to answer any questions about any supports that we are putting into place, and either here or in the chat.
Carolina, there seems to be a specific mental health question in the chat, in the Q&A. Do you mind reading that, please?
Sorry, it took me a minute to access our Q&A. Hay recursos, so are there resources for the 25 counties on mental health, regardless of immigration status? Many families have been affected, deeply affected by the trauma of everything that happened with the hurricane. And that's an excellent question. I would elaborate and ask Lisa, you did just shared some very important resources. We know that 988 is available in English and Spanish. It's a 24/7 suicide crisis and prevention hotline. Can you tell us, maybe elaborate a little more on that question? I think it's both, what resources, mental health resources are available regardless of immigration status, and then with some of these hotlines, are they available in Spanish or other languages?
Absolutely. So the 988 Suicide and Crisis Lifeline, you are correct, is English and Spanish, both chat and calling in English and Spanish. And yes, they are available to anyone regardless of immigration status. They do not they don't even ask about immigration status. That is not what they are there for. They are there really just to support that individual. All of our resources for crisis response, including if additional emergency response is needed in the community, that is regardless of immigration status as well. And so will our crisis count. So our mobile crisis response in the community. We are ensuring that even with our crisis counseling grant that we got, that we're going to have a bilingual staff that are available, and not only English and Spanish, but we're going to ensure that we have access through American Sign Language as well, for individuals that are are out in the community, reaching out to individuals. So all of these, all this to say, please, anyone who is in a behavioral health crisis or needs support in navigating this, please reach out, no matter your immigration status.
Thank you so much, Lisa. I would urge those of us on the call and those who I know that there's folks on the call and other folks who are on the ground that maybe couldn't make this call, but just please share that resource. This is a very challenging time. And as we're talking about housing, I want to reiterate with what my colleague who's doing disaster recovery, Luz Sanabria, was sharing with me just yesterday, in terms of remembering this is going to be a long-term recovery process, and taking care of our mental health and making sure those resources are also available in the long run, in the short term, as we continue to navigate this complex process of recovery. I do know that we're about at 10 minutes before we wrap up this call. So I want to acknowledge those who are also on the call and haven't had a chance to elaborate, mostly on housing. I know that we also have Emily Carmody with Back at Home. And, we've seen some questions in the chat, Emily, about, will there be programs for everyone beyond FEMA? And I think, Back at Home kind of answers to some degree some of those concerns. Can you elaborate on Back at Home and what it is? And
Sure, yes. So Back at Home is the disaster rehousing program from the state. The slides are going real fast. It is the state's disaster rehousing program. If you want to go to the next slide. We have initially launched Back at Home after Hurricane Florence, and also launched Back at Home for COVID. And so at this point, it's being reactivated. Back at Home disaster is being reactivated after Helene. So we, as a program, are designed to assist households that are experiencing homelessness or at risk of homelessness who do not receive risk supports from other federal programs. And it's a program that's operated in partnership with the Department of Health and Human Services and the North Carolina Office of Recovery and Resiliency. You want to go to the next slide? We will be operating back at home, Helene, in the 26 counties that have the hardest impact after Helene. It's the crosshatched counties on this FEMA map that I'm sure you all are familiar with. And if you go to the next slide, we will be offering to households who are enrolled in back at home what we consider housing stabilization services. This is case management services that helps with housing navigation, system navigation, and generally just helping a household stabilize in housing. We'll also be offering financial assistance, including help with applying for your units, assistance with moving into a unit, and then some rental and utility assistance as well. Next slide. As of right now, the first priority population for back at home, the state has designated that as the households that remain in disaster shelters. So back at home is working with the MAST teams to go into the remaining disaster shelters. And after MAST assess them and they do not, and we see that this household is not eligible for other programs and does not have another housing plan, they are referred to back at home by the MAST team. In the future, we are hoping to be able to take referrals for back at home from homeless service systems, otherwise known as COCs, in the area of the 26 counties, and also disaster case managers in the recovery centers after the shelters close. Just to give you guys an idea, again, back at home is a program of last resort. So as MAST teams are in disaster shelters, they are assessing households, they're problem solving with them, they're checking on all their eligibility for different programs. And if there is no other housing plan, that's when the referral to back at home from MAST happens. Next slide. Currently, we have 4 providers who are covering the 26 counties in the disaster area, and these are the disaster shelters that they are working in at the moment. So we have enrolled our first household as of yesterday and are now rolling into other shelters at this point. And again, the shelter households are, disaster shelter households are our priority population at this point. Thank you.
Thank you for sharing this important program. I hope that we're taking note, and I know we'll be sharing these resources after this call for everyone that was able to join us. I do want to give United Way a brief opportunity to also talk to us about 211. United Way is providing resources from both a local and regional perspective, and we have Sarah Roth on the call who can provide a little bit more information on that. Sarah, are you available to share more?
Yeah, I can. I'm happy to. Sarah Roth, I am with United Way of Asheville and Buncombe County. So United Way of North Carolina is actually the administrator for NC211. So that is the Health and Human Service Information Referral Line, 24/7 call to be able to connect to resources. So I can't necessarily speak directly to the work. I think no one from their team was available for this call today. But please know for anybody that is an available resource to call. They do also have a chat function as well, but they are, collecting all of the resources. So if you yourself are a resource provider and you need to make sure that your information is up to date with 211, because they are getting calls from folks looking for that information. So we want to make sure that they have everything as up to date as possible.
Thank you, Sarah. I know we might have a few more minutes, LaDonna, to field maybe a couple of questions, and then we'll have to wrap up. Do you see any that?
I just think just for an awareness standpoint, and just to bring attention to the real, fear of evictions for people that have lost their jobs because of Helene. People that are seeking rent assistance. Can somebody speak to any resources to help with preventing a secondary crisis with evictions and those that can't afford their rent at this time.
I think the state would probably have to address anything regarding evictions. There are disaster unemployment assistant resources available through the state as well. And I will put the link in there for that. But as far as evictions are concerned, that is something that the state would have to address, the state of North Carolina.
Thank you, Nicole.
There's a quick question. This is for back at home. This is a question from Jeremy. Can someone receive back at home services if they're not at one of the shelters?
At this time, no. Again, our priority population at the moment is the households in the disaster shelters. As the disaster shelters close, we foresee being able to serve households who are referred to us through the homeless service systems in the area or through disaster case management, which will be in disaster recovery centers. That is, as funding allows, we are continuing to search and try to grow the pot of resources to support back at home, but that is our ultimate constraint at this point.
I also see that there are some questions about how people can get in touch with the MAST besides being in a shelter if they are displaced, also any home repair services for individuals who do not qualify and are denied for FEMA assistance.
I'm sorry, can you repeat that question again?
Yes, there's a question about how do people get in touch with MAST besides being in a shelter if they are displaced. Also, any home repair services for individuals who do not qualify or are being denied for FEMA assistance.
So if an individual was denied for FEMA assistance, there could be a couple of reasons for that. And so I do want to encourage individuals that if they were denied, they can appeal any decision. Sometimes we need additional information or documentation to prove ownership or identity. And so there is a form that comes with the determination letter that they can fill out and request an appeal for their specific case. But FEMA does provide repair assistance. Like I mentioned, if they were denied, they should reach out. They can either visit a disaster recovery center or contact FEMA directly by filing an appeal. They have an online account. They can do it there, or they can go into a disaster recovery center to do that as well.
Thank you so much for addressing and elaborating on the appeal process, Nicole. And thank you all so much. I want to acknowledge that we tried to answer well more than 50 questions. We have an hour and a half, and we will work to address some of those concerns. Your feedback is essential and allows us to continue to mold and understand the needs and how to move these conversations and support networks forward. So, and again, thank you so much for the amazing work you're doing day in and day out to help Western North Carolina recover from this hurricane. Thank you to those of you who have provided resources in the Q&A, to our panelists. As I just mentioned, I know we weren't able to get to every question, but we're dedicated to supporting you in the ways that you need. We're going to wrap up this session, and we welcome you to join us as we continue these conversations to ensure these vital resources are being provided where and how they are needed. We will share information in our next webinar and teletown hall in the coming days. Thank you everyone so much for joining us, for your time and dedication to these communities, and for helping us all collectively overcome such a difficult time. Take care, and we'll see you next time.